Welcome to the Tytocare Clinician Live Video Visit View. In this short video, we'll show you how to perform a live video visit with a patient using the Tytocare platform. First, let's review some basic visit options. To start, at the top of your screen is a Visit Navigation menu. The navigation bar shows you information about the visit, such as the patient's personal details and their current status. From the navigation bar, you can end the visit. If your organization allows this option, you can also send the patient back to the waiting room. You can also access other visit options by clicking on the three dots in the top right corner of the screen. Here, you can cancel the visit, change the language, and other help options. Next, we'll show you some video conference options. On the left menu, under People, you can see information about the participants in the call. If available in your organization, you can also click here to invite others to the call, such as guests, translators, or other clinicians. You can add them using a list, phone, or email. You can also see the microphone and camera status of all people on the call and control them if necessary. If there are network issues, you'll see them here, along with which network is causing the problem. On the bottom of the video conference area of your screen, you can find the call settings. Here, you can control your speakers and camera or share your screen. You can also hang up the call with the patient, but keep the visit open to write notes and recommendations. The right half of your screen is your exam area. From the right-hand menu, from top to bottom, you can see and control your patient's Tytocare device, access external exams from other supported devices, review exams from this visit in the exam library, either recorded by the patient ahead of time or recorded during the live visit, view visit and patient info, see symptoms reported by the patient, write notes for this visit. During the visit, you can control your patient's Tyto device remotely. Use the exam icons at the top of the screen to select an exam. To stop an exam, click again on the exam icon or simply select another exam. Stethoscope exams. You can perform heart, lungs, heart rate, or general audio exams using the Tytocare device with a stethoscope attachment. The exam will start as soon as you click on the icon. The patient will be automatically muted, and you will hear the audio from the stethoscope. On the main screen, you can see a mirror of what the patient sees on their device. Select one of these numbered locations on your screen to direct the patient to the correct auscultation point. The patient can look at the Tyto app screen to see where to place the stethoscope during the exam. Use the Record button to save the recording to the exam library. Switch between front and back of the chest using this toggle. Your clinician dashboard includes a number of different filters for listening to heart and lung exams. Try out different filters to find the one that works best for you. You can also toggle Boost Stethoscope Sounds on or off, which will let you hear the stethoscope sounds better. To learn more about the Tyto stethoscope sounds, check out the Stethoscope Samples page from the menu. You can listen to real Tyto exams with pathologies using different filters. If you are having trouble hearing the recordings, make sure you are using headphones and check your computer and dashboard volume settings. Performing an ear exam. To perform an ear exam, ask the patient to connect the otoscope adapter. Make sure the otoscope is in position in the ear before you click Start Exam. Each ear exam recording has a 45-second time limit to prevent overheating. Other exams don't have the same limit. The controls on the bottom left side of your screen give you options to improve the image, which can improve the clinical value of some exams. You can highlight the eardrum or the ear canal, enhance the image color, change the brightness of the image, or control the illumination level of the Tyto device otoscope lights. Performing a skin exam. The skin exam shows you a video feed from the Tytocare device, and you can capture an image from your dashboard. Ask the patient to aim the front of the device at the area you want to capture, holding the device steady and about 2 inches or 5 centimeters from the skin. You can focus the image by clicking on the focus icon at the bottom of your screen. When you see the image, click the camera button to capture a picture and save to the Visit Exams library. Performing a temperature exam. The Tytocare device has a built-in infrared thermometer located in the front of the device. Ask the patient to aim the Tytocare device in the center of the patient's forehead, around 2 inches or 5 centimeters from the skin. The device should be in the same room as the patient for at least 20 minutes before an exam. You may be asked to calibrate the device before measuring by asking the patient to point the device at an internal wall for a few seconds. Temperature results shouldn't be measured in an air-conditioned room or if the patient has anything covering their forehead. Performing a pulse oximetry exam. If you see a pulse oximetry exam icon, it means your patient has a pulse oximeter. To perform the pulse oximetry exam, the pulse oximeter needs to be connected via a cable to the Tytocare device. Make sure the patient keeps the cable connected and their finger in the pulse oximeter until you see results on your screen. The results will then be saved to your exams library, where you can also see a heart rhythm graph of the exam. Performing external exams. Some patients and organizations have access to exams from additional medical devices. If you are shown these exams, you can ask the patient to perform them. You will see instructions for how to perform each exam. The exam library. Your exam library shows all of the exam recordings for this visit. If a patient recorded asynchronous exams before starting the video call, they can be found here. The menu at the top of the library will only include exams with recordings for this visit. The red dot shows how many exam recordings for this visit haven't been viewed yet. When all the recordings have been viewed, the dot will disappear, but the recordings are still available in the exam library. Reviewing skin exams. Click on the skin exam icon to see a gallery of all the captured skin images. You can click on each image to enlarge and see additional information, such as date and time, and a body part tag if the patient included it. You can also rotate or download the image. Reviewing ear and throat exams. Select the ears or throat icon in the top menu bar to see a gallery of all the videos taken. You can click on each recording to view the video larger, download, or see additional information about the recording. Some ear, heart, lung exams performed asynchronously before the exams may appear with a yellow exclamation mark. This means our algorithm was unable to validate this exam. Reviewing lung, heart, or audio exams. Click on the relevant exam icon to see the audio recordings for this exam. The top of the screen shows which audio file is playing and lets you change the filters. The bottom of the screen shows you all recordings for this exam ordered by auscultation point. If there was just one recording from a live exam for multiple auscultation points, it will be shown as mixed locations. You can switch between recordings of the patient's front and back using this tab. Reviewing vital signs. All vital signs taken as part of this visit asynchronously before the patient joined the video call or synchronously during the visit will appear here. Some vital signs have buttons next to them where you can see patient notes, attachments, graphs, and other related information. Thanks for watching this tutorial. If you have any questions, feel free to contact support.